Hello, I would like to tell you about my nomination for the Endoscopy Court Charge Nurses. Each member has worked at Rush for several years. They are knowledgeable, respectful, compassionate, and outstanding clinicians. Each member demonstrates skilled communication, fosters true collaboration, has effective decision-making skills, and are leaders. The team was engaged to identify and resolve issues, discover ways to work more effectively, and ultimately provide even better care for our patients. Everything we do each and every day reflects excellence. I hope you can acknowledge this leadership, commitment to clinical excellence, and quality patient care. I feel fortunate and proud to work with them and for an organization that recognizes nursing excellence. Thank you.
Food is incredibly important in health. We can link poor diet to chronic diseases. We can link lack of food to also different conditions. Like malnutrition is often a cause of morbidity and mortality in hospitalized patients.
Even if we were to care for a diabetic patient and we gave them a prescription and we sent them home if they have a home, but they really can't heal or get better if they don't have adequate nutrition or adequate food to sustain them. So actually asking our patients, what is it that they need? And then being responsive and trying to follow up to address those needs. And that's exactly what Food is Medicine is doing.
We screen our patients to see if they are food insecure. There's 2 questions, and if they screen positive to those 2 questions, they are struggling for food for the last month.
I worked with the Greater Chicago Food Depository in coming up with a list of foods that they have readily available. We provide patients with about 2 days worth of food that's non-perishable, so essentially everything's in cans, so a patient wouldn't have to refrigerate or worry about cooking or heating to prepare the food items.
Our volunteers deliver the food to the patients before they get discharged.
About 30% of patients who are admitted to the hospital are food insecure. And of that population, about 15 to 20% exhibit signs of malnutrition. And so we really felt that this was a way for us to help combat that so that they don't worsen their nutrition status.
We've delivered over about 170 bags in our 3-month pilot.
The first bag we delivered, the patient cried when we handed it to him. Then I had to remove myself from the room so I didn't cry in front of him. But it's very touching. They're very moved by it. They feel like people are finally addressing something that should have been addressed years ago.
It doesn't just stop then in the hospital. We now link the patients up with a program called NowPow. And the NowPow case managers now follow the patients after they get discharged to make sure that they're either linked up with a food pantry closer to their home or getting benefits such as WIC.
Rush cares about the community. We're taking the steps to make sure that people who live and work in this community on a daily basis are getting the food and nutrition that they need.
This has been my dream. We're the first hospital that will be actually screening patients and addressing food insecurity in the nation. And just thank you, Rush, and thank you for our leadership team for allowing us to do this.
One of the main things we needed to get out of this initiative was understanding who was in our buildings and how many individuals, and we had no idea before.
So the objective of the committee was to implement a new technology that would allow us to check in visitors as they come into the medical center with the ultimate goal of ensuring that the campus is as safe as it could be.
We had sticker badges that were basically just had the name of the individual coming to visit, and we would guide them to where they needed to go. It took about 4 months to develop all new processes, to identify all the technology needs, to work through all that, and to come to a consensus, because a lot of what goes into this project is really developing consensus across the organization around the rules that we're going to abide by with visitor management. We had to be innovative, creative, collaborative, to develop solutions that work for everyone. The technology we're using is HID safe, which is a technology that's not typically used in healthcare. So we really had to do a lot of work around adapting it to the healthcare setting.
So what's different today is when a visitor comes into the medical center, they're actually stopped by our guest relations associate and they're asked some questions and they present their identification and their picture is taken and they're provided with a visitor badge. So now we know, if you're a visitor to our campus, who's here and their name.
The cool thing about the badge is that after a certain period of time, stripes appear on the badge, and that's a really good indicator for inpatient staff to know that a visitor's badge is expired.
The first week we checked in over 10,000 visitors in 1 week, and that is amazing.
And now we know exactly who is in our buildings and how many people, so it helps us manage more proactively the safety of our patients, visitors, and staff.
I think the way they came together in a relatively short amount of time and implemented these new processes was very significant.
I'm extremely proud of this effort. It's been a pleasure working with the team, and it's been one of the best projects that I've ever been a part of.